You're listening to Rise Above, a Rogers Behavioral Health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction. Hello, listener, and welcome back to another episode of Rise Above. Now, at Rogers Behavioral Health, we deal with a lot of different mental health issues. And this week on this episode, I really wanted to focus on substance use. And today we have somebody who's really made recovery and substance use treatment her personal mission. Her passion is unquestionable. You'll be able to hear it in her voice. She has an incredible journey that has brought her to where she is, and she has an exciting new program to share with us. So today I've got Christina Mundschau, the Addiction Services Liaison for Rogers Behavioral Health, with me. Christina, thank you so much for joining me.
Thank you for having me. I'm so excited to be here.
So your journey to Rogers is an interesting one. Did you want to share a little bit about how you came to be here at Rogers Behavioral Health?
Absolutely. It's actually one of my favorite things to talk about. So thank you for asking. I've been with Rogers as an employee for about 4.5 years, but my journey with Rogers started a few years before that. So I am someone who is currently in long-term recovery from opiates, and I am also somebody who tried for several years, was in and out of different inpatient facilities, and nothing just was really seeming to stick. And Rogers was always the place that I would go to for many different reasons, in West Dallas specifically, because it was closest to my house. But Rogers always was so welcoming and always met me with just this unconditional positive regard. And so 6 years ago, yesterday, actually, I decided to walk back into the doors of Rogers in West Dallas with the intention of going through detox again, as I had done a few other times. But I think that my story had different plans in mind for me. And so I was fortunate enough to go through Rogers' residential program for addiction. It's called the Harrington Center for Mental Health and Addiction Recovery. And traditionally, there was always the one location for Harrington out in Oconomowoc. And I think that's the most well-known one. And it just ironically happened that when I came in to detox this last time, they had just finished building a new Harrington in West Dallas. And so I had an opportunity to be able to go through that program. And it changed my life. It completely changed my perspective on myself. Being able to be provided more than just a few days to really sit down and focus on me and my healing and getting on the right medications and just being provided the right resources ended up being a massive change for me in my trajectory in my life. And so Rogers always will have a really special place in my heart. And it had been a dream of mine as I progressed in my recovery and really started working through the healing process that I felt this need to give back. And I was trying to think of where to start with that, right? As someone at that time who only had a high school diploma, I was really unsure of how I would be able to make a difference. So I was looking for a way to give back, and I didn't know exactly where to begin with that, right? There's so many different organizations and different options. And so I eventually built up the courage to apply to Rogers. And I was about 1.5 years into my recovery at that point when I first started. I started as a tech on inpatient and then eventually worked my way over onto Harrington, the same Harrington in West Dallas that I had gone through as a patient myself. And a few months later, I was given the opportunity to work on Harrington as their recovery support specialist, which was like this hybrid role of an addiction counselor and a peer support specialist. And I got to work in the exact same place that had just completely and monumentally changed my life. So that sort of set into this series of events that led me to this point, and 4 years later, I'm now in this new role where I get to kind of bridge the gap between the recovery communities and our Rogers locations and those we serve.
So how did your personal experience shape the way that you support others now, you interact with other patients now?
Yeah. So I think that if I could say 100%, it completely shapes everything. Every time that I go into, regardless of when I was meeting with residents and patients all the time when I was patient facing, or now on a larger scale or a broader scale of working with other people, I feel like I really try to come into all of those experiences really acutely remembering my own, everything that I had gone through, some of the barriers that I had faced, things that I remember that made a really negative impact on me that I want to be intentional about changing for other people. And so I would say that it acutely impacted the way that I interact with other people and provide care and those services. Absolutely.
So, at the risk of making you cry, what did starting to work professionally at Rogers, how did that emotionally affect you?
Every time I talk about it, I do cry, and that's okay.
I'm so sorry.
No, please don't apologize, because I think that's what makes it so important to me, right? Like,
Yeah.
It's hard for me to put into words, but whenever I share the story about like my very first day showing up to work, I think I was supposed to be at work at like 8 a.m. and I pulled into the parking lot at I think 7:15, 7:20. And the reason was because I wanted to just sit there for a minute and like soak up that moment, and also just take a minute to understand like how far I had come in such a short amount of time.
Yeah.
And I also remember being terrified because I didn't want to screw this up. I wanted to be able to come into this place and feel like I was really giving back. And so that day was monumental for me, but I think the day that really made probably the biggest emotional impact on me was the day that I was given the promotion into the recovery support specialist role. Because I knew that day that I was being given an opportunity to directly work with our patients and be able to hear their stories and be a really small part of the beginning of their journey. And I myself had several people over my own recovery that had done that for me. And to this day, when I talk about those people, I also get emotional, right? Because those were the individuals who helped me change my perspective, not just on recovery, but on myself, right? I think a lot of people don't understand that when you first come into early recovery, the amount of shame that you are coming in with from the weight of your decisions and the consequences of those decisions, and you know acutely that you are responsible for all of those, is really huge. I mean, it's such a huge weight. And so to be able to be a part of lifting that burden with them and helping carry that burden while they start that healing process, it's hard for me to put into words what that meant for me. But it also, to this day, when I look back on that and I get emotional and it starts eliciting those feelings again, it reminds me that I'm exactly where I'm meant to be, and I love everything that I do. So my whole experience with Rogers has been emotional in a good way. And I think that that's a positive thing. I think that reminds me of why I'm doing what I'm doing, the drive behind that, and why I'm committed to this organization.
And we will be right back. Everyone deserves a chance for recovery. That's what drives Rogers Behavioral Health Foundation. They're helping people get the mental health care they need, from covering treatment costs for those in need, to building clinics where care is hard to find, to funding cutting-edge research. They're making real change happen. And guess what? You can help. Head to rogersbhfoundation.org and be part of creating a future where mental health and wellness thrive. And now back to the interview. You've worked really hard on, there's a new program.
There is a new program.
Tell me about the new program.
I love talking about the program because
Right.
as someone who did struggle specifically with opiates,
Yeah.
and as someone who tried to navigate, how do I get in? Who do I go to for resources? In order to have medications, you have to have insurance or you have to have the finances, right? This program that I'll tell you about, in my opinion, is really being able to answer that call for so many people who are struggling every single day throughout the state of Wisconsin. So, back in March, I accepted a new promotion into this role, the Addiction Services Liaison role. I love to say the name because it sounds like I'm a fancy Frenchman, a liaison, right?
Yeah.
And I was excited because it was going to be able to help other people on a broader scale. And at the same time, I had no idea what was about to come. And so a few weeks in, we learned as an organization that we had received a grant. And some people who are listening may be familiar with it. It's the SOAR 4 grant in the state of Wisconsin. It's a combination of state opioid response dollars and funds from SAMHSA, from the state. And ultimately, what it has allowed us to do is to create this program that is low barrier, low threshold, immediate access to medications for opiate use disorder, like buprenorphine or Suboxone, and other medications that fall under that category, regardless of the patient's insured status or ability to pay. And why that's such a huge deal is if somebody is trying to enter recovery and perhaps they know that they will need some medication or medicated assisted treatment to get them going in the right direction, we finally are able to provide a holistic answer for that is really rooted in our organization's passion for co-occurring treatment, right? And so what I mean by that is just providing the medications for someone, that's fantastic, right? And I know from my own personal experience and story that medications aren't everything. I also need to be treating the underlying mental health that is below that surface. And so this program, we have case managers and we have social workers and a nurse practitioner. And so when someone calls in to this line, we're able to set them up and provide them with those resources if they would like them. It's not mandatory. It's not required to take advantage of those services. We encourage them. We are offering them and providing those to those individuals. But I think the coolest part about the program is, and it's a long name, so you're going to have to bear with me.
I was going to say, you haven't
We
named
turned it into, listen, because it's a mouthful. And I think a lot of people, when they hear it, they're like, whoa, that's a long name. But I'll explain why we did this name. So the full name of the program is the Wisconsin Opioid Recovery Telehealth Immediate Treatment Program.
That's a super short name. What are you talking about?
Super short name. Everyone should remember it. The beauty of the name is we were able to shorten it to an acronym because we love acronyms in this field. And the acronym we shortened it to was Worth It. And so I will always call this the Worth It program. But in the name itself, it says telehealth, right? And the reason why that's so important, and I always like to put a little asterisk by the telehealth, is for individuals who may be unhoused and may have no access to Wi-Fi or a smartphone with a screen, it is absolutely appropriate and acceptable for that person to just have access to a phone. As long as they can just call us on the phone, they can access our services within the Worth It program. And that's important because traditionally, telehealth services or telehealth programs similar to this have required having that screen access, which requires Wi-Fi. And a good portion of individuals just simply do not have access to that. So essentially, folks can take advantage of this, our grant dollars, if somebody meets the qualifications of our financial needs assessment, will cover the cost of the medications for them. And we are offering same day or next day access to those medications. So yeah, you're going to ask something.
I was going to ask.
Yeah.
Can you tell me what are the benefits to medication for addiction?
Yeah. I love that we're having this conversation about this, because I think even just a few years ago, certainly when I was first entering recovery, I absolutely utilized MAT, or medications for medicated assisted treatment. And back then it was almost a controversial topic to talk about. Still to this day, there's a lot of stigma that surrounds it. A lot of folks really are not comfortable talking about this sometimes, because there's this perception that if you're utilizing medications, especially for opiate use disorder, that you are not, quote, clean or sober. And I am grateful of the change that not just our system, but our society has made over the years, of really leaning into medications for opiate use disorder and really trying to shine a light on how helpful that can be. And we could go into all the outcomes and all the data. I could go into the statistics that show why medications for opiate use disorder are so successful for folks. Mm-hmm. But I like to focus on myself, because that's been my own experience to share. And as someone who did utilize Suboxone, especially in the early part of my recovery, I then transitioned into the Sublocade injection, and then successfully titrated off of that and have 6 years in recovery. I know what a massive help this medication can be for folks. It's life-saving. It is mitigating the risk of harm for those individuals. Something that I used to always say was, I would much rather have somebody who's been struggling with opiates be on a medication for opiate use disorder than out there risking their chance of not just overdosing, but also dying, right? And so I think when we look at this from that perspective, and we really lean into the benefit to that individual, that it is mitigating that risk, I think that's really important. And any other health concern that someone has, and if they're on a medication for that, we don't normally question that. We don't normally say, why are you taking that medication for your depression? Or why are you taking that medication for diabetes? Why are you taking that medication for your cancer? We don't ask those questions, but we do ask those questions if it has something to do with a substance use disorder. And I like to challenge that, right? This is no different. Addiction is a brain disease. And today, thank goodness, we have medications to help mitigate the risk of harm to those individuals, and also be able to help decrease their craving, and those folks a higher chance of success in their recovery based on the terms and definitions that they set for themselves in their recovery, which I think is so important.
And we will be right back. Real quick, I wanted to take a moment to talk to you about WISE, the Initiative for Stigma Elimination. It unites people across the nation to support those touched by mental illness and addiction. The compassionate approach champions personal stories and powerful connections, fostering healing by reducing stigma through evidence-based practices. Rogers Behavioral Health supports the work of WISE through their Community Learning and Engagement Department. WISE collaborates with a diverse network of organizations and individuals united in the fight against stigma. You can learn more about WISE, explore their 4 key programs, and connect with them by visiting the website www.eliminatestigma.org. And now back to the interview. So what are the next steps for the Worth It program?
Yeah, so we have set up something that's really neat, I think. We have our own separate phone number for the program. And we did that strategically so that when folks call in, they are connected right away. And so
they're not jumping through a bunch of automated things, or,
Exactly. We can connect them right away. They're talking with case managers. They get connected with our provider as soon as possible. We send those prescriptions over. And the phone number for that is 844-582-7827. And when folks call that number, they're connected right away to one of our Worth It team members, and we begin the process right away. If someone calls in and all they want is access to that medication, that's completely fine. We will do initiation of the Suboxone. We will do bridge. We will do maintenance. We will do many other things also. For folks who do have insurance, we can also prescribe them long-acting injectables like Sublocade or Vivitrol. And because Rogers is a co-occurring organization, when folks call in who may also be experiencing symptoms related to their depression or their anxiety, we can also include medications for that in this as well, which I think is important to point out because most people who are calling in or are entering early recovery, it's never always just the substance use, right? There's other things that are happening under the surface, like we talked about. And so being able to meet them with that and provide access to that is incredibly important.
So I can see your passion. The people listening can hear your passion. But for you, what's the most rewarding part about working on this program and at Rogers and all of this for you?
Yeah, I feel like that's a loaded question because there's so many answers that I could give you. For this program specifically, and I think it's because I was one of these people. I was in and out of incarceration and really struggled to find resources or anybody who would provide me access to a path of recovery like this without a million barriers. And so being able to be part of this, being able to go in front of organizations and different county jails now and presenting this information and being able to say, look at this incredible solution, look at this program. This is really tailored to meet the needs of those people who are struggling out in our communities without all those barriers has been not just rewarding, but I think also validating for me to see how far we've come, not just as an organization, but just as in our society as a whole of how we are looking at this, how we're coming up with solutions to problem solve for folks struggling. And I also think that being able to be part of an organization that helped save my own life obviously is a big part of that too. I'd be lying if I said it didn't.
You're providing hope for people.
We're providing hope for people. I've had a few opportunities to go out and do outreach in the communities with unhoused communities. And just being able to see when I explain to them what the program is and being able to see their face light up and really be able to know and feel inside that we're making this difference and that there is hope. We have options. There are programs available out there, and this is one of those. And that it impacts the entire state of Wisconsin, all 72 counties and 11 federally recognized tribal organizations is monumental. And I think hope is such a phenomenal word to use for that. Because it is, we're providing hope to people, but also just meeting people with compassion and not judging them and providing them as much support as we possibly can without those barriers. That is the definition of hope in my mind, and I'm proud of that.
Is there a website people can go to?
So a lot of our information is on the Rogers website, and we also have created our own separate email so that if anyone has questions or maybe they would like us to send flyers or FAQ or anything like that, the email address is worthit@rogersbh.org. We also now have a lot of our materials have been translated into Spanish as well. And so we are able to provide those to folks. So if you're looking for more information or flyers or anything at all, please send us an email, give us a call. We will provide as much information as possible. Or if you'd like myself or one of our Worth It team members to come and provide a presentation going over all of this and answering questions, because there are normally a lot of questions, we're more than happy to do that. I enjoy talking about this and getting the word out so more people can utilize it.
You said you enjoy talking about this. Is there anything else you want people to know about the Worth It program?
Yeah, I think it's really important to note that the funding for the Worth It program is fully made possible by SAMHSA and by the Wisconsin Department of Health Services through the state opioid response grant. And so that is how we've been able to make this entire program possible.
Awesome. And I'm sure we are going to talk more about the Worth It program in the future. Christina, it has been a pleasure. Thank you so much for joining me.
Thank you for having me. It's always so fun to talk with you, and I always love talking about all these initiatives, so I appreciate the time. Just grateful.
I'm sure we'll do it again.
I'm sure. I hope so. Thank you.
All right. Have a good one.
You too.
Bye.
Well, listener, thank you again for tuning in to another episode of Rise Above. And if you or someone you know could benefit from the Worth It initiative, again, it's the Wisconsin Opioid Recovery Telehealth Immediate Treatment. Please send an email to worthit@rogersbh.org or go to the website rogersbh.org and just search for Worth It. Whether you're uninsured or not ready to stop using or simply need help fast, this program meets you where you are with dignity and compassion. And as always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening. Thank you so much. See you next time.